Primobolan, a very controversial compound. It is highly favored by many bodybuilders, including Arnold. He mentioned it as his favorite compound. On the other hand, some bodybuilders like Rich Piana, one of the most well-known fitness influencers who unfortunately is no longer with us, he had a completely different opinion. Rich Piana viewed Primobolan as a very weak drug, calling it a waste of time and money. Primobolan is also considered the most commonly used compound among women, beside Anavar of course. So, in this video, we'll dive deep into everything you need to know about Primobolan, its history, medical uses, and unique properties. We'll also discuss how it is used in bodybuilding and other sports, covering its dosages, benefits, and side effects. And we'll discuss both opinions about Primobolan and the reasons why some see it as a very good compound while others hate it. We'll answer the question, should Primobolan only be used during cutting phases, or does it also have a place during the off-season? And finally, we'll explore its usage among women. So, whether you are a bodybuilder, an athlete, male or female, or simply curious to know more about this compound, this video will cover everything you need to know about Primobolan. So, let's get started with the history and medical usage of Primobolan. Primobolan was first described in 1960. The pharmaceutical company Skip introduced the drug to the US market and sold it under the brand name Nibal. After a short time, Schering here in Germany, which is now Bayer, took over the rights to the drug and began selling it under the brand name Primobolan. After that, Primobolan was primarily produced here in Germany and a few other European countries. Regards its medical usage, Primobolan was used to enhance recovery and combat muscle wasting from surgeries, infections, or wasting diseases. Also used to treat osteoporosis among women and to promote weight gain in underweight infants. It proved to have a very good track record for clinical safety. To this day, Primobolan is still produced by the pharmaceutical company Bayer and can still be found in a few countries, such as Turkey. Aside from that, it is also produced by the illegal underground labs. Let's move to the next point, which is the structure and characteristics of Primobolan. Primobolan is the trade name, but the chemical name is Methenolone. It is derived from the hormone dihydrotestosterone, or DHT, and it comes in two forms. The first form is Methenolone Enanthate, which is the injectable form and is attached to a long ester. The ester determines the absorption rate of the hormone in the body after the injection, the half-life of the hormone, and the duration of its effect in the body. The second form is Methenolone Acetate, which comes in a tablet form. The half-life of the injectable form, Methenolone Enanthate, is about 5 to 8 hours, while the half-life of Methenolone Acetate, which comes in tablet form, is only 4 to 6 hours. It needs to be taken at least twice or 3 times a day to maintain stable hormone levels in the blood. The androgenic anabolic ratio of Primobolan is 44 to 57 androgenic and 88 anabolic. I will explain this in a second. The androgenic properties are simply the effects related to male characteristics. Things like deepening of the voice, increased body and facial hair, oily skin and acne, or aggression. The anabolic properties are the effects that support the growth and repair of tissues, like muscles and bones. Things like increasing muscle mass by promoting muscle protein synthesis, improving bone density, and helping the body recover faster from workouts or injuries. All anabolic androgenic steroids have both androgenic and anabolic properties, but the ratio varies with each compound. This ratio is always compared to testosterone, which has a ratio of 100 to 100. This is why scientists created anabolic steroids, to increase the anabolic effects and reduce the androgenic effects to minimize side effects. Let's talk about Primobolan usage in bodybuilding. Primobolan is a very controversial drug among bodybuilders. As we mentioned, some like it and others don't like it at all, and they see it as an overrated compound. I will do my best to remain unbiased and simply present both opinions for a fair discussion. Primobolan usage in recent years has become a trend. Many athletes nowadays prefer running testosterone at lower dosages while relying on higher dosages of Primobolan. They often depend on it as the primary compound for driving anabolism during the cycle. The reason behind this, that Primobolan has a very low side effects profile, and it is highly tolerated. Let's not forget, it was even used for medical purposes in infants and women. And also Primobolan builds lean muscle mass without any water retention. Many users prefer running it over Masteron during the off-season. Some argue that it might be a better muscle builder than Masteron, and it may have a better effects on health markers, which allow users to take it for a long periods and at high dosages. For these reasons, users often save Masteron for contest prep, as Masteron is more androgenic and may result in a better cosmetic look on stage. But of course, Primobolan can be also used in a cutting cycle. But really, to be honest, I think the difference between Masteron and Primobolan in terms of results is pretty mild, and it might even go unnoticed. So here I would say, it comes down to personal preference. And now, let's talk about why some people see Primobolan as a waste of time and money. As we discussed, Primobolan is a very well-tolerated compound, but it is also considered a weaker mass-building compound. So, it needs to be used in higher dosages to achieve the desired results. This leads to the argument often made by old school guys, why use high dose of a mild drug instead of a lower dose of a harsher drug that might give the same effect, which is a pretty valid point to consider. For example, in a hypothetical scenario, and I'm just throwing numbers here, would it be better to run 400 milligrams of Deca or 1000 milligrams of Primobolan? Both might lead to the same increase of muscle tissue, but which option would be better for health markers? The mild compound at high dose or the harsher compound at a lower dose? You can really argue for either of these approaches. And anyway, our understanding and opinions about the usage of these drugs tend to change over time. At the end of the day, even if Primobolan is considered a mild compound, that doesn't mean you can run it at extreme high doses and expect to avoid any health consequences. Which brings us to the next point, which is the side effects of Primobolan. Primobolan is considered an anabolic steroid with very low androgenic side effects. And the androgenic side effects like hair loss or body and facial hair growth are generally not expected. This makes it the best injectable anabolic androgenic steroid for women. There was even a study on Primobolan that involved 27 women with advanced breast cancer. These women were administered 1,200 milligrams per week of Methenolone Enanthate, which is the injectable form of Primobolan. This is considered an extremely high dose, especially for women. Surprisingly, these women tolerated it very well, with minimal virilization side effects. This shows how mild Primobolan truly is, and why it's an ideal choice for women trying to avoid virilization symptoms. Also, I have to mention that Primobolan is a 5-alpha reduced, which means it doesn't convert into DHT. If you are experiencing hair loss while using Primobolan, taking something like finasteride won't help. Regards its estrogenic side effects, Primobolan doesn't pose any risk, as it doesn't convert into estrogen. It actually does the complete opposite, as it has anti-estrogenic properties, so there is no concern about gyno or water retention at all. And adding it to a cycle can help control estrogen levels instead of relying on aromatase inhibitors. But be careful, Primobolan might crash your estrogen levels, which is something you need to keep an eye on. Low estrogen levels can lead to issues such as joint pain, reduced libido, fatigue, and the impaired muscle growth. That is something you have to keep in mind. Regarding hepatotoxicity, as we mentioned before, Primobolan comes in two forms: Methenolone Enanthate, which is the injectable form, and Methenolone Acetate, which is the oral form. Usually, oral steroids are C17 alpha alkylated compounds. This is a chemical modification added to protect the compound from breaking down during oral administration, allowing it to provide its desired effects. The chemical modification also puts high stress on the liver. Surprisingly, Methenolone Acetate, the oral form of Primobolan, is not C17 alpha alkylated. This makes it pretty safe on the liver and is very unlikely to put significant strain on the liver. However, this also means it is a weaker compound, as it is mostly broken down by the liver and you can expect a lot from it, especially for men. In general, it is better to stick with the injectable form, as it is more effective for achieving the desired anabolic effects. Regards cardiovascular side effects, all anabolic androgenic steroids have a negative impact on lipids. They tend to decrease HDL, which is known as the good cholesterol, and some of them, like Anavar, may increase LDL, which is known as the bad cholesterol. All DHT derivatives like Primobolan are well known to be harsher on lipids compared to other compounds. This happens because Primobolan has anti-estrogenic effects, which may lower your estrogen levels, and estrogen plays a positive role in maintaining healthy lipid profiles. So, this is something to keep in mind when Primobolan is used in high dosages. But of course, oral compounds are the harshest on the lipids. Additionally, all anabolic androgenic steroids, including Primobolan, can raise blood pressure. So, it is essential to monitor your blood pressure on a regular basis and keep it under control. Before we talk about Primobolan and testosterone suppression, if you found value in this video, please give it a like and subscribe to the channel. On this channel, we cover all topics related to bodybuilding and fitness, including training, nutrition, supplementation, and PEDs usage to help you build the physique you want in the fastest and safest way possible. The usage of all anabolic androgenic steroids will cause natural testosterone production suppression. So, testosterone should always be the base for any cycle, as it is the primary hormone that the body relies on for proper function, and it converts into DHT and estrogen, which are necessary hormones not only for overall body function, but also essential for muscle building purposes. It is most likely that the recovery of your natural testosterone production should return after using Primobolan and taking post-cycle therapy or PCT, as Primobolan tends to be less suppressive compared to compounds like Nandrolone. Your natural testosterone production may also return without PCT. It could just take much longer. So, taking a PCT, in my opinion, is the better option instead of rolling the dice and see if natural testosterone production comes back on its own. Or you may never recover 100% at all. There is always a risk when you use anabolic androgenic steroids that you might never return to normal. Even though it is rare, especially in the beginning, it would be completely irresponsible if I didn't mention this. In the case if you plan to use anabolic androgenic steroids long term anyway, in my opinion, going back to TRT would be a better option, as you will anyway depend on TRT after years of cycling on and off. And now, let's talk about the dosages of Primobolan for medical conditions and among athletes. The prescribing dosages of Methenolone Enanthate for medical conditions among both men and women are 100 mg every 1 or 2 weeks or 200 mg every 2 to 3 weeks, while the prescribing dosages of Methenolone Acetate for medical conditions also among both men and women are 100 to 150 mg every day, which means 700 mg to 1050 mg per week. That is 7 to 10 times more than the recommended dose for medical purposes in the injectable form. This highlights just how weak Methenolone Acetate is when it is compared to Methenolone Enanthate. And don't forget, those dosages were used to treat medical conditions. For muscle building purposes, much higher dosages are commonly used. The dosages for physique enhancement for Methenolone Enanthate, the injectable form, for men, 600 to 700 mg per week is a very common range. Some users only add 100 mg on top of TRT, but let's be honest, at that point it is not TRT anymore, it is just a small cycle. Advanced users may go up to 1 gram or even 1.5 gram per week, depending on their level and physique development. For women, dosages between 50 to 100 mg per week are pretty standard and well tolerated. Let's talk about the dosages of Methenolone Acetate, which is the oral form. To be honest, I wouldn't recommend using it at all for men. As we have seen, for medical conditions, dosages went up to 1050 mg per week. So imagine how much would be needed for physique enhancement in men. The dosages would become completely unrealistic. For women, a daily dosage of 50 to 75 mg per day is more common. Let's move to the next point, which is Primobolan availability and supply. Methenolone Enanthate is still produced by only one pharmaceutical company, Bayer. You can find it in a very limited countries, mostly in Turkey, where it is sold under the brand name Rimobolan. And of course, it is produced by underground labs. You will typically find it at 100 mg per 1 milliliter concentration, available in 10 milliliter multi-dose vials or ampoules, or sometimes in 200 mg per 1 milliliter. You will find it under different brand names in the marks such as Primobol, Primobolic, Primobolan. These are just brand names, but the compound itself remains the same, Methenolone Enanthate. For the tablet form, Methenolone Acetate, I don't think there is any pharmaceutical company that still produces it. At least none that I'm aware of. Maybe there is, but I really doubt it. However, you can still find it from underground labs. It usually comes in 25 mg or 50 mg strengths. Here is a very important point, especially for women, to keep in mind. The price of the raw material of Primobolan is pretty high, which is why it is commonly faked or underdosed. You might end up getting something entirely different like Masteron or even EQ instead of Primobolan. And that increases your risk of experiencing virilization symptoms. So it is absolutely crucial to ensure you are getting a genuine product. That's also another reason why many bodybuilders don't like Primobolan, considering its price and how often it is faked or underdosed, not to mention it is a mild compound and usually comes in 100 mg per milliliter, which means higher injection volumes. They tend to favor Masteron over it, as it is a cheaper compound and less commonly faked, which, by the way, I have made a detailed video about, so click on this video to learn more about Masteron.